And I think what you said right now is very important. Nobody knows you better than you. So if you feel like something is wrong and you tell your physician and you feel like they're maybe not addressing it the way you would like it to be addressed, don't stop. Keep pursuing another opinion or self-refer yourself to a specialist because again, I've seen women who were, for lack of a better word, blown off
Right.
or dismissed and told that everything was fine. They're too young to get breast cancer, or, oh, you don't have a family history. I bet you're fine. And the woman trusted, and said, okay,
Right.
and moved on. And unfortunately, there was something wrong. So I'd much rather see a patient who has nothing wrong with her and tell her she's okay than to have the patient who waited too long because she was dismissed or felt
Right.
that it probably was nothing anyway. So trust your instincts.
Absolutely. I want to remind our viewers, let our viewers know that our lines are open. The number's at the bottom of your screen at area code 312-738-1060. Lines are open. If you have any questions for us, for Dr. Alvarado, please give us a call and we'll answer them as best as we can. So, Dr. Alvarado, there's also been, I don't know if it's a myth or whether or not it's factual, that breast cancer can be inherited. Is that indeed true?
Yes, it is true. Most cases of breast cancer are not inherited, though. So most women that actually are diagnosed with breast cancer have no family history, have no genetic mutation that's been detected, and just get it per chance or bad luck. But in at least 5 to 10% of cases, there is a hereditary cause for it. So something that was passed on from your mother or your father, which is important too, because a lot of women think they can only get it from their mother, and it's not true. You can get it from your father as well.
And actually, that's a myth. It's one of those myths that are actually out there that says you could only inherit it from your mom.
Correct.
What are some of the side effects? I mean, there are so many treatments out there as well for breast cancer, and there's wonderful new treatments that are out there.
Yes.
But one of those, obviously, is being chemotherapy, which is the one you hear most about. And some of these treatments do have side effects. So what are those side effects for chemotherapy?
Those definitely vary from patient to patient, and the regimen that you're put on is going to vary depending on the kind of breast cancer that you have, the stage that you're at, how advanced it is, and other different factors that differentiate one breast cancer from another. But by and large, if you're getting standard chemotherapy through a vein, the standard side effects that most women will get, unfortunately, are hair loss, feeling tired, run down, fatigued. It can affect your blood counts, which can make some patients more susceptible to infections. There can be associated nausea and vomiting. And again, once you get into a particular type of regimen, the side effects are going to vary a bit. But those are important to go through with your oncologist when the time comes. And there are oftentimes medications that can be prescribed to help alleviate some of those symptoms to make it as comfortable as possible.
Right. Now, there's also the side effects of tamoxifen. That's a big name that you hear a lot out there.
Correct. So tamoxifen is not given to all breast cancer patients, but it is indicated for breast cancers that are estrogen receptor positive. So estrogen, as you know, is a hormone that we produce naturally as women, and some breast cancers are fed by that hormone. So the tamoxifen helps to block that receptor so that the estrogen is not effectively feeding that breast cancer and causing it to grow. It's a very effective treatment, and again, a lot of women are candidates for it, but unfortunately, some women have side effects. Something I tell all of my patients is if you're a candidate for it, please do try to take it because it's actually well tolerated by most patients. But if you're going to get side effects, the most common ones are menopause type symptoms, so hot flashes, vaginal dryness, atrophy. But again, there are other medications that if the side effects are severe enough, we can try to prescribe to patients to make those symptoms more tolerable.
Wow. So but like we said, there are so many treatments out there, and definitely be prepared to ask your questions when you're going to go see your doctor and you're going to visit for first or follow-up or whatever the number of visits are. You're not happy with what you're hearing from your first physician, get a second opinion.
Right.
Go and get that second opinion. Have your questions laid out. Ask those questions.
Absolutely.
And it's always better to write them down and take them with you.
I always recommend that to patients because oftentimes what happens is they will come, they will listen, they will ask one or two questions and then say they're done and call me a day or two later with their questions, which of course I receive those calls and I'm happy to answer them. But it's always better if you have your physician in front of you with that list of questions.
Absolutely.
And it's your time. This is not an easy disease to deal with. Never feel like you're asking too many questions. That's what we're here for.
Absolutely. Now, Dr. Alvarado, I know that you also have, well, we hear, let's put it this way, we hear a lot of times that breast implants can hinder taking images of the breast. Is that indeed true?
Yeah, so if you have breast implants, it does not mean that you can't get mammograms, but it does make the imaging a little bit more difficult, and just be prepared and know that more images are going to need to be taken. Standardly, we get 2 images of the breast in different positions. When you have implants in place, you get those images done as well as additional images with the implants displaced. There's always a chance, depending on the surgery and the anatomy of the patient, that some of the breast will be missed in that mammogram, making it all the more important to not only, I think, do your own self-awareness, self-exams, and also getting your clinical breast exam by your gynecologist or breast surgeon if you're seeing one.
Right. Now, I also know that sometimes a lot of women out there will say, you know, gee, my breasts hurt all the time. I'm really fearful that I may have breast cancer. Can it really be that? I mean, is it something that contributes to that? Are you really in pain? Is that one of the side effects?
Yeah, so one of the symptoms of breast cancer can be breast pain, although that's fairly rare. I see a lot of women with breast pain. Actually, sometimes it turns out in a day that that's most of what I'll see, because it's a very common symptom. Luckily, most of the time it is benign. A lot of women will experience breast pain at one time or another in their lifetime. It can be dependent on their menstrual cycle. Most women get breast pain, like I mentioned earlier, right before their cycle, during their cycle, and it can be pretty significant, causing a visit to the doctor, for example. Oftentimes it can be due to certain foods. Coffee, although not scientifically linked, seems to cause some breast pain as well. So all these things need to be taken into account. But if a woman comes to me and says that she has breast pain, I definitely make sure that she's had the appropriate imaging, that I review it myself, do a thorough examination, and rule out breast cancer, because it can disguise itself that way too. So although it is not common to have breast cancer present with pain, it is a possibility, so it needs to be ruled out. But my goal is to rule that out if I can, and tell the patient and reassure them that they're going to be okay.
Absolutely. You know, I also like to just remind our viewers that if you have any questions or you need some advice, please feel free to call Dr. Rosalinda Alvarado located at 3000 North Hosted Suite 711. At Illinois Masonic Medical Center's campus on Hosted and Wellington. Or if you need more information, you can also reach out to the American Cancer Society at 1-800-227-2345, 1-800-227-2345, or Rosalinda Alvarado at Illinois Masonic Hospital. Now, Doctor, I know that one of the new technical marvels that are out there is this 3D imaging. Can you talk to us about that?
Yes, I think it's a very nice tool. There's not a lot of long-term data on it yet because it is relatively new, but what we're finding is that it can be very useful in women who have a higher density of breasts. And that's a hot topic right now. A lot of women are seeing this on their mammogram reports and asking me, why are they reporting about my density now? What's going on with that? And basically, breast density is alarming to us because it means that the breasts look whiter on a mammogram. And cancer also looks white. So it's very difficult oftentimes in a woman with very dense breasts to distinguish what's normal from what's a malignant tumor. And so with 3D mammography, you basically get to see the breast in 3 dimensions and rule out that that density you're seeing is truly just breast tissue that is thick and or overlapping on itself, as opposed to a cancer. So it's a little bit more sensitive for detecting breast cancer. Like any diagnostic modality, it's not 100%, but I do find that it's very helpful in women with very dense breasts. It does add a little bit more radiation, but I think for a woman with very dense breasts, when she is counseled appropriately by her doctor and recommended, then I think that slight risk or increase in radiation is worth it.
So it's definitely something. Is the radiation the same as it was 20 years ago?
No, things have gotten more specialized, more localized, and so there is radiation there, but we definitely have investigated this thoroughly and know that the benefit of doing the mammogram outweighs that risk of the radiation.
Absolutely. So Dr. Alvarado, can you tell me what are some of the things that women can do to prevent breast health, to prevent cancer.
So I think the first thing that women can do is just educating themselves about their family history, their background, and knowing, is breast cancer or any other cancer something that runs in my family? And if it is, investigating that, talking about that with your doctor, and basically understanding whether you are a patient who is at high risk of developing breast cancer in the future. If that is not the case and you find you don't have a significant family history, there are still things that can be done. Maintaining a healthy lifestyle, exercising at least 3 times a week has been shown to be of benefit in reducing the risk of breast cancer. Maintaining a healthy weight is also shown to reduce the risk of breast cancer. We know that estrogen is produced in fat cells, and so the more of that you have, it does show to be associated with an increased risk of breast cancer. Also heavy alcohol use, so avoiding that is also smart, not only for breast cancer but for other diseases, as we know. And recently we've also found a link between smoking and breast cancer. So it's important for women to not smoke, not only for the risk of lung cancer that we've known and oral cancers, but now breast cancer too.
Well, you know, I just want to take it back to, we were talking about radiation and 20 years ago versus today. So is the radiation from a mammogram harmful at all? It's such a small dose that it's not harmful?
Well, any radiation is going to be cumulative. So if you were to get a mammogram every month, then I think that would be harmful.
Sure.
But if you're getting it when it's scheduled, and hopefully not getting CT scans all the time and things like that, then it's reasonable. But if you think about the radiation we're exposed, even going on a flight, the radiation you get from that is much more than what you get from a mammogram. So although I think we need to be cautious in the tests that we order and realize that there are potential effects, knowing that the benefit outweighs that risk is the most important. And that's why that's one of the reasons we also don't do mammograms in very young women, not only because of their breast density, but also because of that exposure to radiation. And then when you're thinking about previous radiation exposure, so women who had Hodgkin's lymphoma at a very young age were treated with extensive chest wall radiation. Those women are at very increased risk for breast cancer in the future. So it's not something to be taken lightly.
Yeah. Well, I mean, people don't think that when you're traveling and you're getting on a plane, you're not even thinking about radiation exposure. I'm sure that's something that doesn't cross my mind.
And I don't mean to alarm people and say don't fly, but what I'm trying to get at is there's a lot of things in our daily life that expose us to some radiation. So I would not avoid getting a mammogram because of that fear, because as I said, the benefit outweighs that risk.
Doctor, I also want to remind our viewers that this coming Saturday, October 11th, we are hosting our annual breast cancer prevention program lecture and free clinical breast exams. Dr. Rosalinda Alvarado will be joining us that day, as well as our guest speaker for the lecture. It is free. Breakfast will be provided. So for anyone who's interested, please give us a call. You can reach us at 1-800-3-ADVOCATE or 1-800-323-8622. Again, that number is 1-800, toll-free, 323-8622. If you'd like to register for Saturday's event, you can also reach us at the Hispanocare office. Again, that number is toll-free, 1-844-414-7979. 844-414-7979. The lecture will be both in English and in Spanish. So we have a lot to discuss. Free clinical breast exams. Come out, join us for a wonderful morning of education, learning, and prevention. So, Doctor, one of the other things that's constantly out there, especially with demographics changing in our Chicagoland area and worldwide, actually, is that the differences that are really noted in minority communities, in this case, the Latina woman. How are there the differences noted in Latina patients versus the non-Latina patient?
Well, first off, it's important to note that breast cancer is most prevalent in Caucasian or white women. However, Latinas get breast cancer as well. The downside to the breast cancer that Latinas get is that unfortunately they tend to be diagnosed at more advanced stages and tend to have more aggressive breast cancers, such as triple-negative breast cancers. So that's something that patients need to be aware of and know that those differences exist. Also, demographically, and when you think about access to care, we do find that African American women tend to get their mammograms not as often as they should be getting them. Latinas tend to be a little bit better than that, but we still have some work to do. But we do see some differences there as well with access and with regard to their stage at diagnosis, unfortunately.
You know, and today with the Affordable Care Act, if you have been fortunate enough to enroll into ACA, this is something that's covered 100%. This is something you can go see your physician, get your mammogram. And if not, open enrollment is coming around. It's about open enrollment that time of the year now, and ACA is out there. Please enroll, get covered, get your mammogram. At the same time, there are also fairly qualified health centers that do provide these as well, that you can get these free of charge. So it's just that the resources are out there. And if you have any questions or if you need more information, always feel free to call us over to Hispanocare, Community Health and Education, Illinois Masonic, and we'll be very happy to help you in any which way that we can to help you with those referrals and information resources. So, Doctor, if you were to give a message to our viewers, especially our women viewers, what would that be as it relates to breast health?
I would say to be proactive. No one's a bigger advocate than yourself. You have to voice your concerns, be proactive about your health, do that clinical breast exam, talk to your doctor, go to your visits regularly, and make sure that you're being proactive about getting that yearly mammogram ordered if you're of the appropriate age, and addressing your concerns and really making sure that you're heard. And when you walk out of that visit with your doctor, that all your questions have been addressed. I can't stress how important it is for you to advocate for yourself and make sure that you're heard and taken care of.
Absolutely. Dr. Alvarado, we have a caller on the line. Caller, you're on the air.
Hello.
Hi.
Hi. Thanks for taking my call.
Absolutely.
I actually started really perking up when you were discussing breast cancer because I recently had an ultrasound on my breast. But I had a question more specifically about what I've been hearing recently in the news in terms of the Ebola virus. I plan on traveling soon, and I guess I'm sort of leery about being on a flight with someone who's traveled internationally and, of course, coming into contact with the virus. And I just wanted to know, like, if that's a legitimate concern at this point, like, based upon the information that you all had just as a healthcare agency.
Well,
we'll try to answer that for you. Thank you for the call.
Thank you.
Doctor?
All right. So, we're talking mainly about breast cancer, but as far as the Ebola goes, I know everybody is concerned about it, especially with that documented case in Texas. I do think they've educated us well, telling us that symptoms may arise several days or even weeks later. So I think that, and that's when the exposure happens too. So they're being very careful about screening people before they board these planes and making sure that everyone else is not going to be at risk. So I think that your concern is legitimate, absolutely. But I don't think we should put our life on hold for a lot of these things because there's deadly diseases all the time, and I think that we need to just educate ourselves and be careful, but not live in fear all the time as well. And like I said, I think they're doing a really good job of trying to contain these things and coming up with ways to care for these patients who do suffer from this disease. But luckily, there haven't been huge outbreaks here in the United States, and hopefully it'll stay that way. So I think if you need to travel, again, weighing the benefit to the risk, and I think that risk is there, but it's pretty low at this point.
Thank you, caller. It's a great question, though, and definitely a topic that we should come back with, and we promise to do that. So, Dr. Alvarado, our time here goes by so quickly that sometimes I sit here and go, we just don't have enough time. But I'd love to have you back, invite you back, and so much more that we can talk about.
Great.
Thank you for coming again. I want to remind our viewers that joining me today was Dr. Rosalinda Alvarado, with Advocate Illinois Masonic Medical Center. And Dr. Alvarado, if you have any questions for her, please give her a call. Area code 773-296-3390. Again, 296-3390. Obviously, you can always get a lot of information with the American Cancer Society. My interview remarks is that breast disease, like cancer, can be a moral battle fought with overwhelming stress and devastating physical and emotional impact. Talking about that today, important. Ladies, please, if you need a mammogram, go see your doctor. If you don't have one, find one. Hospitals everywhere can give you those referrals should you need one. And obviously, it's very important. Prevent, prevent, prevent. Prevention is key. So on behalf of all my colleagues here at Hispanocare, Illinois Masonic Medical Center, and Dr. Alvarado, thank you so much for coming on
Thank you.
today. And can't wait to see you to come back. A lot more to talk. So please stay tuned. A lot of information coming your way. Shows next. We look forward to seeing you again. Until next time, my name is Lucy Aquino with Advocate Illinois Masonic Hospital and Hispanocare. Thank you for watching CAN Cable 21. Till next time.